Adebambo. I'll be your anchor for today while we have this very beautiful conversation. All you need to do for us right now is to sit back, relax, and stay educated, be informed, because your health is a major priority. Many a times, many of us see these particles of blood, this little blood pieces in our stool, and then we just feel it is normal. It will come and it will go, but then it is more, way beyond that. Today on the issues, we would have this discussion with Dr. Akonde Olusoji, who will do well to put us through this conversation. We go on a very short break. When I return, we begin this conversation proper. Good morning, Lagos. Good morning, Nigeria. Do not forget that you can join this broadcast live from anywhere all over the world via our website www.ikd1061fm.ng. That is www.ikd1061fm.ng. You can also stream this broadcast live by watching us on Facebook at IKD1061FM. That is on Facebook at IKD1061FM. If you have questions during the course of this conversation, you can type them on our Facebook page. We will do well to read them out. And you can, of course, call the studio lines directly on 0904 081 1061 or 0904 082 1061. Today we talk about blood in the stool. But then I would first off to start this conversation. Like I told us, our guest is already well seated in the studio here in person of Dr. Akonde Olusoji. I want to start off by saying well done to every medical practitioner in Nigeria today. The truth has to be told. You are all doing well. I was around your workspace, that is General Hospital Ikorodu, last week for 3 different days. To observe. We do that sometimes to see how affairs are being run, and I see how agitating the doctors are working, knowing fully well that a lot of the doctors are also doing the japa thing. But the ones we have here are not hesitating to do their job. So I'm saying well done to every medical practitioner in Lagos, in Nigeria, most especially General Hospital Ikorodu, and to also seize this time to say a happy birthday in arrears to the MD. I call him Prince, but it is okay to professionally call him Dr. Taiwo Azan, a very great man as well as that of Imota Hospital too as well. So, Dr. Akonde, how are you doing today?
I'm fine. Good morning. Thanks for having me here this morning.
It's good to have you in the studio.
It's a wet day and the
Mm-hmm.
weather is relatively cold.
Mm,
And it would be good to know one or two things about our health
exactly.
that is important to our existence.
Mm,
So, like he has said, what you are looking at today is blood in our stool.
mm,
And as a form of introduction, when we eat, it passes through our what you call intestine,
yes.
right from the mouth to the esophagus into the stomach, where the initial stage of digestion takes place before it
Mm,
goes to what we call small intestine, where the important ingredients are extracted into our body
mm,
for the body utilization. And before it now proceeds into what we call large bowel,
mm,
and that is where the water is absorbed and where feces is formed.
mm,
So what I mean by stool is feces, and it is the waste product
mm,
that is now expelled from the body through our anus,
mm.
and that is the way God designed
The
the
human system.
operation
Mm,
of the body.
mm,
And we all know, we are familiar with the normal color of the stool,
mm,
which is brownish yellow, and that is what we pass. Whether it is watery, whether it is hard, it has a constant color. It is when it is watery that it becomes diluted.
mm.
And this stool coming out tells us a lot about what is happening inside us,
Inside the body
inside the
system.
body system.
Mm,
And that is why it is always important for us to, after defecating, after uh, passing the stool,
mm,
it's always good to look back and look at what you have passed.
mm,
Okay, how does it look? A lot of people will just pass through and walk away and flush it. Yes, yeah, quite a few number of people are still using pit latrine, but government has tried to discourage that. That
Exactly.
every house should have a water closet, and
Mm.
when you use water closet, be be fair enough to get up and look at into that closet
Mm.
and look at what your stool looks like.
Dr. Akonde, we have so much to talk about today,
Yeah.
and I like the fact that you've started off with a very brilliant introduction. Some will tell you it's disgusting. I do not look at my stool because I don't want to feel disgusted and all that. So, but I don't want to agree to that at all. It is not disgusting, like you've heard from the
It's
doctor.
not
It will help you to know what exactly is going on in your body system.
exactly.
The first question I would like to ask, aside for that brilliant introduction you just gave to us, when you look at the extension of our focus for today, talking about take it seriously. Originally, we are talking about blood in the stool. Take it seriously. I want to ask, when we talk about blood in the stool, how important is it for us to take it seriously? The reason is we have people who will ignorantly just tell you that it happens, it comes, and it goes. How important is it to take it seriously? After then, we look at what are the causes. But before we get there, let's talk about why it is important for us to take it seriously.
Generally, blood is within the body compartment.
Mm,
And you agree with me that, for instance, if two people are fighting and they stab themselves
mm,
and blood start flowing, a lot of people say, "Ah, he is
mm,
bleeding." Oh,
mm,
some people even near seeing the blood, some
mm.
people collapse.
It's a
You
state of
know,
emergency on
it's
its
a
own.
state of emergency, and that's to tell you how important blood it is to us.
Mm,
And if you are losing blood, that means you are losing part of your the volume in our what you call vascular part of the vascular volume.
mm,
And if that continue, it could lead to low blood pressure, and
mm,
such a person can actually collapse. That's by the way anyway. So when you see blood inside your stool,
mm,
you look back and you see, there's blood in, it should give you a lot of concern.
mm,
It means something is bleeding along your intestinal tract, which is not supposed to be. Blood
mm,
is not supposed to be part of our stool. So, and when blood is you are passing out blood, it means you are losing blood gradually. If it goes on for a long time,
mm,
there will be a point that the person will become anemic, we have shortage of blood,
mm,
you know, and that is the time they start having one form of complaint or the other, weakness, dizziness,
mm,
and they start having this malaise.
mm.
And what is happening? Because when you don't look at it, you just pull and you walk away.
And you look away.
You walk away,
Mm,
and the thing keeps on happening. You
mm,
will not know. But if you see the moment you see blood in your stool, you know that I must do something about it. You must ask questions.
mm,
Ask questions from people who are not knowledgeable about health. You
mm,
may have a nurse around you. You may have a doctor around you. You can even walk into any hospital and let it be known to them that this is my observation.
mm.
And that way, of course, the doctor will not just look away. He will ask one or two questions about things that is happening in your body, and it's an indication to quite a number of things.
We will talk about those indications. We'll talk about the causes. Some of these common causes is what next I want us to talk about. But a very quick question to ask: when we talk about blood in the stool, some will believe that it is maybe because of the things we eat. Talking about our meal, how true is that, or is that a fallacy?
Well, it could be related to it. Okay, like blood is, some people, they when they get to it, the first thing they see is blood flowing.
Mm,
Some, the blood will be mixed with the stool,
mm,
and in some cases it will be after they might have finished stooling that the blood will start coming.
mm.
You know. And sorry, what was the question again?
That is this when you talk about blood in the stool? Could it be because of the
Okay,
food,
yes,
the
food.
kind of things we eat?
Yes, it may, at times it's related to the food,
Mm,
but not the normal kind of food that we eat,
mm,
But there are some situations whereby when some people, they feel that, okay, I'm not feeling fine, and instead of visiting the hospital, they decided to use some herbal drugs,
mm.
which you cannot determine the level of what is inside it. And when you take it, you don't know what is good. What is good for Mr. A is different from what is good for Mr. B.
Exactly.
And the rate at which they tolerate things differ from one individual to individual. So some people, I've
Mm,
seen some people, they take that about, and before you know what's happening, they start having spurious diarrhea and blood.
mm,
Because it can cause, such a thing can cause erosion of the lining of the intestine, which could
mm,
result into bleeding, and you see it in your stool as time goes on.
mm.
So that's where what you take has to do,
It also has a part to
has a
play.
part to play. So
Mm,
we must be mindful of what we ingest, what we eat. Very,
mm.
very mindful of what we eat.
Thank you very much for that clarification. If you're just joining us, it is the issues on IKD 106.1 FM, and we're talking about blood in the stool. It is important that we take this very, very seriously. Now, we want to talk about some of the common causes, when we have blood in the stool. What are most of these causes, that could warrant one seeing blood particles in the stool? What are some of the common causes?
Yeah, one of the commonest causes of
Okay.
hemorrhoids is a clinical condition in which there is dilation of some vessels around the anus internally, and that as that one progresses, there is protrusion of tissue in the through the anus, and some people. It's not all patients with tumors that bleed, but quite a number of them bleed, especially when the passes adds to, and it at times causes very torrential bleeding. So if you a lot of people will we call hemorrhoids. Generally, people call it jedi jedi, but in Yoruba, jedi jedi is comprises of so many things in Yoruba, but
Mm,
specifically here hemorrhoids. And also when we have a
okay.
tear in the anus, especially when the pass very hard stool and the person has to strain and the stool has to come out. Pooah, it
Mm,
causes a tear in the anus, and that one too can cause bleeding, can result into bleeding. It,
mm,
it creates a kind of wound
mm,
around the anus, and which takes time to heal. So in time, it's just like the wound out on our skin. In time, something brushes over it. Uh, it it activates bleeding, and you see blood in the stool. So that's why we must do everything humanly possible to ensure that our stool is not hard. Also, there are other uh, things that causes we call inflammatory bowel disease. Uh, it might be difficult for people to know, but for those who are medically inclined, they know what I'm talking about.
mm.
That's diverticulitis, Crohn's disease. But the most important thing why I'm talking about this, decided to choose this topic is cancer of the
Cancer of the intestine.
because it's usually seen along the colon. That's the
Mm,
large bowel,
mm,
and it's a thing that starts insidiously. It starts as a small growth, and
mm,
it will growing inside the intestine. A little time, it will bleed, and you see blood inside your stool. No pain, nothing,
mm,
and because there's no pain, it keeps on
mm.
growing. But occasionally, it will bleed, and you see blood, and that is where you know we are very, very concerned, because we believe generally in medicine, we believe early diagnosis and early treatment. Quite a number of patients come to us with symptoms of advanced cancer of the intestine,
Mm.
and it's because they were not observant a lot of time. So it's not all of them, but when you see that blood in the stool, it's and you have investigated it, quite a number of times we are able to detect such cancer early, and
Mm,
treatment is given.
mm,
Also, the other cause is ulcer, peptic ulcer disease. Ulcer, it could occur in the stomach and first part of what you call duodenum. Ulcer, everybody knows about ulcer. They say, when they have pain in the upper part of the tummy, they say, I have ulcer.
mm,
Yes. when ulcer is confirmed when you do certain investigation. So that ulcer too can bleed, you
Mm.
know, and we can bleed a lot that patient could also collapse. The blood could be so low and could also collapse.
Mm.
And in that situation, the color of the blood uh, is a little bit is what we call dark and tarry. Is
Okay.
dark compared to the one from the anus, from the one from
Mm.
the colon, which is usually bright red.
Mm.
You know, so but whether it's black, tarry, or bright red, for a layman, blood is blood, and you must talk about it. You must ask questions about it, and
Then how
visit your
can we
doctor.
distinguish between the bright red blood and the dark and tarry blood? How can is there a way one can know that this is this and this is this? Is it possible?
I say it's possible. The bright blood is fresh blood.
Okay.
It's fresh, just like somebody who sustained a laceration or a cut on the hand. You know, that blood is bright red.
Mm.
It's fresh blood. You know,
Mm.
but the dark one, because it's coming from the upper part of the intestine, and it
Mm.
has passed through different parts of the intestine, so the enzymes have acted on it. The
Mm.
color have changed. You know, it's like stale blood.
Mm.
So when by the time you are passing it out, it becomes blackish in color,
Mm.
tarry,
Mm.
you know. So definitely anybody can be able to, unless if the person is colorblind, you
Mm.
know, be able to, this is fresh blood or this is black. So when they come, we ask patient, okay, what's the color of this blood, so that we have it gives us an
An
idea
idea.
where the bleeding could be coming up even before we investigate the
But
patient.
Dr. Akonde, when you talk about coming to the hospital, which is one good thing, is it in all cases where one has blood in the stool that requires coming to the hospital, or is something that could have self treatment, like what we call self first aid? Do we need to always come down to the hospital if at all there are signs that okay there are blood in the stool?
Well, if you, for me, I would say yes.
Okay.
Yeah, because it's not normal for blood to be in your stool.
Mm.
So apart from the cost of, but the amount of money you're going to spend cannot be compared to when you come down with cancer or when you
Mm.
come down with a serious ailment.
Mm.
So it's better to come to the hospital eh, for the doctor to carry out one or two tests and be sure that yes, this is an ordinary, this is just an hemorrhoid, or this is just a tear, you
Mm.
know,
Mm.
and we are happy. You understand? For us to ignore it, and say, okay, let me wait, let me see
You
if
could
it is
just,
going to,
yeah, it could be a
let me,
minor
could
thing.
be a minor thing,
Mm.
let me use paracetamol, let me use antacid,
Mm.
maybe it will stop, you know. Yeah, some could stop, you understand? But if it doesn't stop, okay, and you
Mm.
ignore it,
So it's better to
and
be on the
that
safer
tumor,
side.
yes, and that tumor starts growing in the body,
Mm.
you know. So for me, if you see blood, it is not normal. Seek medical advice.
Let's talk about the symptoms now. One of the best ways that you have clearly stated, you said that when you use the toilet, you just look back.
Yes.
There is a proverb in Yoruba, is it a proverb or an adage when they talk about always looking back? But I don't want to go there. So it should be the same with your stool too as well. Now,
Yes.
aside that, what other symptoms can one have? As a medical practitioner that you are, what are the symptoms one will feel and you feel like, there is an issue somewhere. There is
Uh,
blood in my stool.
well, observing it is one.
Okay,
And when
yes.
you observe it, yeah, it comes with. The other thing I forgot I mean, I've not mentioned is even typhoid.
Okay.
Typhoid arthritis, can cause bleeding,
Wow.
and you see it in this too. But in typhoid, the person will be very sick.
Mm.
Fever, headache, malaise. Even before blood start appearing in the stool, the person may have been admitted. So the other symptoms you can talk about is related to shortage of blood.
Shortage of blood.
Yes, by the time the patient is bleeding on and off, there is a reduction in the level of blood in the patient's body. So they
Mm.
start presenting with weakness,
Mm.
eh, malaise, feeling unwell,
Mm.
and if it is cancer, discover that they start losing weight, you know. And in cases like ulcer, they start having pain in the upper part
Upper
of the
part of the tummy.
tummy, and they heat, they feel bloated up, they feel funny, you know. And uh, like I said, weight loss, you know.
Mm,
And in the case of cancer, cancer could grow such a way that it can block completely the passage of intestinal content.
mm.
So which could lead to what you call intestinal obstruction, a blockage of the intestine. And I don't think we should wait until that happens before we seek for help.
Talking about some of the dangers of blood in the stool, you talked about cancer of the intestine, which people out there listening would agree that this is very dangerous. I want to penetrate a little bit into the clinical settings now, which I would appreciate if you can help us clear. In clinical settings, how can a medical practitioner, or what are the process like in diagnosing, knowing that okay, this is where the problem comes from, because there could be factors and reasons to why there is blood in the stool. So how is it like? How can one diagnose, or how do medical practitioners like yourself diagnose and tell that this is what is wrong?
Okay, so like there's what we call occult blood, and there's that's you may not even see the blood per se, you
Okay,
know,
okay.
in the stool. And
Mm,
there are ones in which yes you see the blood. So the basic test first to do is what we call occult blood test.
mm,
That's you take a sample of that stool, you send it to the lab, you say check it for is there blood in it or not.
mm,
You know, there are reagents that they can so the it can come back is yeah, there's blood inside the stool. There's no blood in it. If there's blood in it, then we now progress to the next stage. You
mm,
know, that's clinical examination. The doctor will take time to examine the patient from head to toe, and also examine the anus.
mm.
That one we call it digital rectal examination.
So it gets to that point.
Yeah, to get to that point, you have to examine your patient from head to toe, especially the abdomen, that's the tummy.
Mm,
You check it very well. Then you have to examine the anus.
mm,
And how do you examine the anus? The doctor, you explain to the patient that this is what I'm going to do. I'm going to insert my finger into your anus. So it
the
tells
doctor will insert a finger into the anus.
into the anus to check if there's any growth. If there's any growth even around that area.
Mm,
Around taking his fingers and the finger around the place and be sure that there's no because like I told you, cancer can occur along the intestinal tract, especially the large bowel, even up to the anus,
mm,
you know. So if you don't check, eh, you will not even know that okay, even in the anus something is growing there.
mm.
So that's why a good doctor must look, must palpate, and must check before you ask the patient to go. And after doing that, even if that place is free,
Mm,
you still have to take a step further.
okay.
The ultrasound scan will be done for the patient.
Mm,
Then, for those ones in whom you are suspecting that okay, this patient may be having cancer,
mm,
especially if a combination of weakness, abdominal pain, mild abdominal distension, your patient feels filled up easily. You know, you want to do what you call endoscopy. That's endoscopy means that passing a tube into the anus to look at inner part of the intestine.
mm,
You know, that's for the one involving the large bowel. And also you can pass it through the upper part of the spine to look at the place. When you pass it, you look at it on the screen and be sure that okay,
okay.
is there any problem here? Is there any problem there? Is there any problem
Mm,
there? And area where there are problems, you take a little out of it.
mm,
Take it, bite the place, take a little out of it, bring it out, put it in a container, and send it to the lab for analysis.
mm,
Does this tissue contain cancer cells or not?
mm,
You know, because that one is very, very important.
mm.
So if it says it contains cancer, then we institute treatment. If it says it doesn't, we still treat along. Okay, we'll be happy that okay, this patient is free from
Exactly.
cancer. You
Mm,
understand? So you can monitor the patient and reassure the patient. If it is just ulcer in the stomach or in the duodenum, we continue with anti-ulcer drugs, and patient gets better,
Mm.
and even the blood will stop. Everything will stop. You understand what I'm saying?
Let's talk
So,
about preventive measures too as well. How we can prevent. It is good to know that there are solutions to this problem of blood in the stool. But then I also want to believe that we can also prevent it, just like it is said, prevention is better than cure. But then I also want to ask, I am curious to know, when you say blood in the stool, does it have to do with age factor? There are some illnesses that they will tell you that when you are getting to a particular age, you start having this kind of sicknesses. When you are a baby, you start having this kind of particulars. But for blood in the stool, does it have to do with age? Is it a sickness for adults or the older generation or the younger generation?
okay, thank you very much for that question. Yeah, age is very important in everything concerning that has to do with health.
Mm,
When when a young patient comes telling me that he has blood in his stool,
mm,
the first thing that comes to my mind is something what they call benign,
mm.
okay, that is not likely to be cancer,
Okay.
because at a younger age, you don't
Mm,
expect that, okay, you would have developed uh, 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 a cancer. So age, a younger age group, you look at, okay, maybe the hemorrhoids,
mm.
tear in the anus, or some kind of inflammation going on, or even an ulcer,
Okay.
because quite a large number of young people these days, they drink different kinds of concoction,
Mm, mm,
which can cause erosion of the
mm,
erosion of the intestine. So I've
mm.
seen quite a number of cases, come with serious bleeding because of what they have taken in. So but by the time somebody about 40, 50, you
Mhm,
tell me that you see blood in your blood, the first thing I want to rule out is say, I hope it's not cancer. Eh?
mm.
In the So I have that high level of suspicion. It could be, it could not be. So I'm on the lookout. But what will clear it is my examination and investigations which I'm going to do. So age is also very important, because as we grow old, there is that tendency for people to develop one form of cancer or the
Or the
other.
other. Thank you very much. I would like for us to also accommodate calls if people want to call in and ask questions. But then I will take this very first message here. This person really wants to know, is it normal to bleed thrice? And the person gave a breakdown of the three times. The first time, and the person said that was last year, December. The second time was March this year. And the third time was May this year. So this person wants to know, this one is not like a regular bleeding. It's not everyday bleeding. It's not constant. There are breaks in between. Is that normal?
Well, it's not normal.
Most definitely,
Bleeding,
it is not normal.
yeah, bleeding into your stool or
Mm,
bleeding to you through your anus is not normal.
mm,
Whether it's once or twice or thrice,
mm,
you understand. The only thing is that, you see, the is likely to be not to be cancer, but that still does not mean that we will not investigate why that patient is bleeding. Though, let's remember that I said, if you're bleeding, if you lose a half glass cup uh, today, another time you lose another half, it's reducing the blood level. Though the body try to compensate
mm.
more, there's an increase in production of blood, you know. But you shouldn't be mindful of the fact that a large percentage of people are not eating well again. Yeah, because what the body utilizes to produce blood is in our food.
True.
So a lot of people are not eating well. They are not eating healthily.
Mm.
Most people eat once a week is likely to be not to be cancer, but that still does not mean that we will not investigate why that patient is bleeding. Though, let's remember that I said, if you're bleeding, if you lose a half glass cup today, another time you lose another half, it's reducing the blood level. Though the body try to compensate
Mm.
more there's an increase in production of blood, you know. But you shouldn't be mindful of the fact that a large percentage of people are not eating well again. Yeah? Because what we utilize, what the body utilizes to produce blood is in our food, you
True.
know. So a lot of people are not eating well. They are not eating healthily, you
Mm.
know. Most people eat once a day now, and your body, you are generally losing the power to compensate.
Mm.
You know, in Nigeria today, it's a general thing, and the class of those people in that category is expanding every day.
True.
You get, so that's
True.
why
True.
you don't have to wait until things get out of hand because it's costlier.
Mm.
If you allow things to go suddenly collapse, start to treat such a person is more expensive.
Mm.
So if you see it, come so that you can be investigated. I will do something about it to stop whatever that's causing the bleeding.
Thank you very much. 09040811061 or 09040821061 is the studio line where you can call in today and ask our guest, our Dr. Akonde Olusoji, questions as regards our focus. Let's take this first call. Hello.
Hello, good morning.
Yes, good morning. Thank you for calling. What's your name and where are you calling us from?
Yes, I'm Mr. Yusuf Olamilekun Adedeon from Alakoko, Lagos.
Please go ahead, Mr. Yusuf.
Thanks to the doctor, I'm enjoying his analysis. He's trying to come down to a layman's level, so we are getting it. So my question is this: for an ulcer patient that has experienced bleeding, slight bleeding in the stool in the past and has been treated, what are the lifestyle modification that patient can take to avoid such in future again?
All right. Okay. Your question will be attended to. Thank you very much for that one. Yes. Okay, Doctor, I think that is clear.
Also, outside, if you treat it very well, it will heal,
Mhm.
and it may not come back unless something brushes over the sky again,
Again.
and it start bleeding again.
Mm.
So it's like the same thing applies to the one inside the the intestine. If you do the right thing, take your drugs properly, as prescribed, and you avoid skipping diet.
Mm.
Take don't if you have been fasting, doing marathon fasting before, and you've been eating the peppery food before, you have to step it down.
Mm.
Make sure you don't skip your food because what is being secreted in the stomach is acid.
Mm.
If acid has nothing to work on to digest, it starts affecting the linings there. So you must make sure that you put something in your stomach when you are supposed to do so.
Mm.
And one thing I want to say about that one is that no, you are not confirmed as being having ulcer until you did what you call upper GI endoscopy,
Okay.
whereby that's when you pass through tube into your throat and look at the inside of your stomach, because that one is very very important as well. Because a lot of time we are treating ulcer. Meanwhile, ulcer as when it's not properly treated and over a long period of time can change
Mm.
to cancer.
Ulcer could change to cancer.
Yes, after a long period of time.
Wow.
So you need to go and do it and to look at it, look at this, say okay, it's ordinary ulcer confirmed.
Mm.
Then take these drugs over a period of time,
Mm.
you know, and such ulcer response.
Mm.
But in some situation that has been on treatment for a long time, you get there and you see that the ulcer has started changing,
Mm.
you know.
Mm.
So all those ones, you take a little out of it and send it for histology, like I said the other time, so as to okay, the thing has not started changing to cancer.
Mm.
So like the gentleman said, try and eat as I told you. um if you're fasting, if you are reduce the rate at which you fast,
Mm.
and I'm sure you'll be fine.
We are still taking in calls on 09040811061 or 09040821061. You can ask questions from our guest today, Dr. Akonde Olusoji, talking about blood in the stool. We take another message. This will be the second message from our social media. This person is saying that I only see blood in my stew whenever I take something hot and peppery. What does it mean?
What it means is that go for a checkup.
Okay, that's
It's as simple as that. And
mm.
like I said, I'm still
So I think this
insisting.
person does not have is not a regular thing. It just
Uh,
comes only when person
anyways,
takes
I don't,
something
and if
peppery.
you notice that you take when you take something hot or whatever,
Mm,
and you see blood, stop taking it. Yeah, but there is no reason why you take that kind of thing and you start bleeding.
mm.
Something must
There
be
is a
missing.
cause.
That is a cause. So
Mm,
go for a checkup.
mm,
There are things that could be done to locate, is there any problem along your intestinal tract that is reacting to, you know, what you have taken. You are just assuming the person is just assuming that it is the food that is responsible for it, and it might not be food, the food at
mm,
the end of the day.
mm.
So I will encourage such an individual to try and visit a, an hospital where it could be properly attended to.
So, Gbemi, the sender of that message, you've heard, Doctor. Gbemi, go and see your doctor. It's as simple as that. One other thing that people always avoid is going to the hospital because of the cost implication. How affordable is it? Let's take this other call. Hello to you.
Hello, good morning, sir.
Yes, good morning. Thank you for calling.
Yeah, yeah. I called to ask. Whenever I use the restroom at times, but I notice that happen if I take too much of soft drink as a mineral. I mostly see blood in my
Your
discharge.
stool.
Yes, 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 my tooth.
Yes, yes, yes. We've heard you. The doctor is doing justice to your question. Please just stay with us. You can go ahead, doctor.
Yes. One rule about life is this: if you're taking something and your body doesn't like it,
Mm,
stop it. Stop it. There is nothing that you cannot do without in life.
mm,
And if you're taking sugary thing, taking soft drink, and you feel is the one responsible for the bleeding. But I want to emphasize something. One thing that it may not be the cause. It may not be
exactly.
responsible.
Exactly.
Uh, Try and get to the hospital. Let them do the needful so
Mm,
that you know why is there any point where the bleeding is coming from,
mm.
and that will be sorted out.
It's just as similar as to that message we had that from Gbemi saying whenever I take something hot or peppery, so see your doctor. Talking about seeing the doctor, how affordable is it, to get treated when you talk about blood in the stool? People run from the hospital. You have said it yourself that some will just give themselves self medications. Some will use herbals to try to solve all of these health issues. The reason some do that is because they feel that when you go to the hospital now, they'll tell you to buy one medicine. That one is 10,005, especially now that medication has become, so expensive. How affordable is it to treat yourself when it has to do with blood in the stool?
That's where the challenge is. Because um, yeah, investigating patients for these could be a little bit expensive.
Hmm.
Because the most important investigation
Hmm.
is the endoscopy.
Okay.
The simplest of all the investigation is okay, if you are doubting whether blood is blood or not, is the what they call blood, checking the stool.
Hmm.
But the moment you confirm that there is blood, the next thing you want to do is patient should go for that endoscopy.
Hmm.
I must confess that it's not cheap.
It's not cheap.
It's not cheap. But that is where government needs to come in. You know,
Hmm.
generally people need help. You
Hmm.
know, health insurance should be able to cover most of this, but unfortunately, it
It
doesn't.
doesn't.
But in centers where,
Hmm.
it covers it, they have a way to go about it.
Hmm.
Even those that have uh, uh, family history,
Hmm.
yeah, of cancer of the intestine, encourage them to do that test, you know, from time to time, maybe once in 2 years, once in 3 years,
Mm.
in order to check, see, this person is not developing that. Maybe the father or the uncle has had cancer of the intestine
Intestine.
before.
Mm.
So we are encouraged to do that. You
Mm.
know, even those who are working, for them to be able to afford that test. So I want to use this opportunity to appeal to government, uh, um, well-to-do individuals in the
Mm.
community.
Mm.
They can give some kind of subvention, to centers where these tests have been done.
Mm.
Maybe in a year, okay, I will take care of 100 people that wants to do this kind of endoscopy or colonoscopy,
Mm.
and offset the bill so that if patient come and you see that okay, you have indigent patient who cannot afford it, you know.
Oh, okay. Sorry, a call just busted. Hello. Yes, good morning. Thank you for calling. What's your name and where you calling us from? Jushe, go ahead with your question. We lost that call. But, you can call us back. You can call us back from Ijomu. With the voice of Mama, but then,
So as I'm saying, if
yes.
you have what to do, you can go to different centers, where they have facilities to do. And okay, I want to sponsor 100 of this
Mm,
investigation.
mm,
And for those of us in government setup, okay, we know that that kind of arrangement is available here, it's available there,
mm,
so we know patients that are indigent that cannot afford it, send such patients to that place. So
exactly.
we may not leave everything to government.
Mm, mm,
Government is trying, they're trying their best,
mm,
but like Shakespeare will still continue to hammer it, because if you don't do something
mm,
early enough,
mm,
early treatment, early diagnosis is very important in the
mm,
management of these patients, especially I'm having those with cancer of the intestine. Some of them, we discover them early, they live long after, you know.
mm,
But a lot of patient comes in advanced stage, whereby just do palliative,
mm. And then
and even at
it's
that,
almost gone.
even at that stage,
Mm,
the cost is still high.
mm.
So, but if you're able to get get diagnosis early and treat early, we are all happy. Patients are
Yes,
happy.
thank you, Doctor. We have about just 10 minutes to sign out from the studio, but we still have a lot of questions. I see you on our social media, Yusuf Adediran. Thank you so very much. I will join you shortly. You've been talking about tests, you talk about scan, get checked, but I've not heard you talk about medication. So I am curious to ask, does medication have a role to play in the treatment process? Do you people, doctors, prescribe drugs? Does drug have a role to play, or it is not a necessary factor when you talk about treatment?
Yes, medication has a role to play. Patient with hemorrhoids, bleeding hemorrhoids, there are drugs to give them,
Okay.
and there are things we ask them to do,
Mm,
for the blood to stop.
mm,
And by the time we institute that treatment, a lot of time the bleeding stop.
mm.
And we also advise them dietary advice.
Okay.
Okay, drink lots of water to
Mm,
avoid your stool being hard.
mm.
Take lot of fruits. Take lot of vegetable so that your stool will come jeje,
Easy.
easy. So it will not be hard to tear your anus and you
Mm,
start bleeding.
mm,
It will not be hard not to push out hemorrhoids and bruise the vessels and start bleeding.
mm,
So medication and dietary advice. For those that have ulcer, of course, it's the same thing. Medication, eat as at when due. You know, don't take anything that will further hurt the ulcer.
mm,
You know, avoid alcohol. Those who are smoking, stop smoking.
mm,
And by the time you do all those things, the ulcer heals.
mm,
And for those we investigate and find out that okay, there's something is going and we have taken drugs to confirm the diagnosis. Those ones, operation, go ahead and operate them.
mm,
Uh, Remove that part of the intestine that is causing problem.
mm.
Send it for histology. If it confirms it, we still go for a second stage of treatment.
Mm. Thank you so very much, Dr. Akonde. Just to confirm that the same way I am, learning and enjoying every bit of your words in helping us to enlighten us as regards our focus We also have Adedino here sending his regards to you that he's enjoying every bit of what you're saying. Thank you very much, Adedino,
Thank you.
for that particular one. Now let's talk about preventive measure. Prevention, they say, is better than cure. Can blood in the stool be prevented? If yes, how can it be prevented?
Well, it's a lifestyle. Huh?
Lifestyle. Mm,
Lifestyle. You try as much as possible, avoid anything that could predispose you to it. I've talked about constipation, passing out too. Take lots of water,
mm,
eat readily, you know, anything that will feel irritates your intestine, avoid it.
mm,
If you take lots of alcohol, could be one of it. Cigarettes, predispose you to quite a large number of things.
mm,
And uh, if you have what it takes to go for medical checkup,
mm,
make it a point of duty to go for medical checkup
mm.
from time to time.
All right. Thank you very much for that one. Now, another thing I want to ask, that we know, for instance, General Hospital Ikorodu, there are always appointments, especially for some kind of treatment or special people. How does it work, for somebody right now listening? Many a times you have said it here that when you see the blood particles in your stool, don't hesitate, come down to the hospital. How is appointment like? Is it something that somebody can just come at any time, or there are particular days? I know Thursday is for. I know the operation somehow in general, but for checking of this blood in the stool, how does it work with General Hospital Corridor?
Well, you see blood in your stool.
Mm,
Yeah? It's not it's not an emergency per se.
okay, okay.
Yeah?
Mm,
But you don't wait until it becomes an emergency. It can
mm,
become an emergency. I told
mm,
you about it. An individual bleeding hemorrhoids or bleeding torrentially. Before you know it collapsed. That one is an emergency. You could give it straight into the emergency room.
mm,
That one immediately the patient will be attended to.
mm,
First of all, to resuscitate the patient. But the other ones, you can come in through a general patient department,
mm.
GOPD, and that place is 24. I mean, it's open every day,
Every
Monday to
day.
Friday.
Mm,
You know, so you can take a card and you'll be attended to by first line doctors. And when they look at it, they do what they can do. And if they feel that yes, medication should be able to sort out your problem, they give it to you.
mm.
But by the time I give appointment, but
Okay.
by the time you come back and you're not getting better, they send patient to the surgical unit,
Mm,
whereby we recommend more comprehensive, we do more comprehensive examination and more comprehensive tests. But by the time the doctor in GOPD sees the patient and says, we know that something is
mm,
amiss.
mm,
So we have that high level of suspicion, So, but the hospital is accessible.
mm,
Mm. So even if it's an emergency you can still runs in Saturday, Monday, 24 hours.
mm.
You know, the emergency room is also 24 hours opening. But any patient can walk in,
Anytime.
and not well anytime. Yes, especially in the morning time.
Okay.
GOPD,
Mm,
you see a doctor there.
mm.
But even after the closing hour, you can go to emergency and see the doctor. The doctor will decide whether it's your case is emergency or not.
Oh
If it's
no.
emergency, you attend to. If it is not, the right medicine for you, and give you appointment to go and see them uh, in GOPD and continue with the treatment.
One of the reasons why this particular topic is so germane to you, Dr. Akonde, is because of the danger of cancer of the intestine.
Thank you very much.
When I saw this topic, I also saw some of the stories I attached with, and I say it is very dangerous. Talking about how dangerous it is, the link it has with cancer of the intestine. Please put us through, enlighten us on that particular sector.
Yes, like I said, what you pass out is a reflection of what is happening inside your gut.
Mm,
And we should make it a point of duty as an individual to make sure that after defecating, after passing through,
mm,
look back. Don't walk away. Look back and before you flush, peep and see, okay, my stool is okay.
mm,
Fine. Then flush.
mm,
So early diagnosis of cancer of the intestine, of the colon, uh, is very, very important because early diagnosis and early treatment, quite a large number of them. I've known a patient that I operated about 20 years ago and is still living. for cancer of the colon
Over 20 years
over
ago.
20 years ago, and is still living. And by the time your patient has cancer, uh, goes beyond 15 years, the person is regarded as being cured.
Mm,
You get what I'm saying? Now,
mm,
like those people that comes late, 5 years, 3 years, 5 years, they are gone,
mm,
and you don't want that to happen.
mm,
We are not happy about it. So when you see blood in your stool, please don't ignore it. Try
mm.
as much as possible, whatever it could take you. First of all, come forget about the cost of
The financial
the financial.
implications.
Come, you
Mm,
see how to give the patient a soft landing,
mm,
and see how to go about it. But you want to know, is this one a benign, ordinary bleeding coming from hemorrhoids, coming from inflammatory process,
mm,
or is he the patient is the patient cooking cancer somewhere along the
along the line.
intestinal tract?
Mm.
So I want to encourage us, please don't ignore other symptoms when you see blood in your stool.
Thank you so very much. But then I will still want to ask you what will be your parting words. You have really done well with all that you have said. Your advice to everyone that has listened to you today, still listening to you. Maybe they've been through this before. They are just seeing the signs or they've not seen it yet. What will be your parting words to everyone out there?
Yeah, lifestyle modification.
Mm,
As one grows old, you should be mindful of what you eat. You should take lots of water. Let fruits and vegetables be more in your food,
mm,
because all those ones also help with detoxification.
mm,
You know, and avoid anything that will irritate your intestine,
mm.
that will ulcerate it, that will give you a wound inside. You know, and uh, above all, always look back and check your stool.
Above all, always look back and check your stool. I have taken that down, and I hope everyone out there also took cognizance of that important fact that you should always look back and check your stool. We want to say thank you so very much, Dr. Akondi. That was quite educative and healthy for everyone out there who has listened to you. This is how far we can have it today on the issues at IKD 106.1 FM. Join us on another episode of the issues. I remain yours truly, Opeyemi Adebambo. Remember, your health is wealth and it is very important. God bless Nigeria. God bless every one of you out there. It's a bye for now.